An 85-year-old man in the emergency department. His abdomen has become distended and he has not had a bowel movement in a week. His heartbeat 80 beats per minute. His blood pressure 130/80. The patient cannot communicate with the care staff due to a neurological disorder. Hello everyone, my name is Narang Vang and my topic is about non-seizure neurological disorders. So some background about neurological disorders. They are diseases of the central and peripheral nervous system. All over the world, there are more than 600 of these disorders, ranging from epilepsy, dementia, migraine, Parkinson's, brain tumor, and many more that I cannot list in this 10-minute presentation. Now about the nervous system, it is active in nearly every aspect of our health and well-being, ranging from everyday activity such as waking up to automatic activity such as breathing to complex processes such as thinking, reading, remembering, and feeling emotions. There are two components of the nervous system, the central nervous system and the peripheral nervous system. The central nervous system comprises of the brain and spinal cord, whereas the peripheral nervous system is every other nerve and those attached to the nerves outside of the brain and spinal cord. So the topic of neurological disorder is very broad due to the many types of disorder. Even when the topic is reduced to non-seizures, it is still very broad. Therefore, I'll be talking about a disorder that causes a decline in mental capability and reduce a person's ability to perform everyday activity, known as dementia. So dementia is not a specific disease. Instead, it describes a group of disease. It describes a group of progressive symptoms that affect memory and cognitive skills severely enough to interfere with daily functioning and gradually worsen over time. As you can see, there are many types of dementia, with Alzheimer being the most common. There are also many causes of dementia. One cause is damages to brain cells, which interfere with the ability of the brain cells to communicate with each other, and, and those damages can affect thinking, behavior, and feelings. The different types of dementia can be associated with the particular types of brain cell damage in a particular region of the brain. Dementia can also be caused by other diseases and conditions. Along with the many types of dementia, there are also many symptoms. The symptoms usually vary depending on the cause and type of dementia. However, the most common includes these cognitive changes from memory loss to confusion and orientation, and psychological changes such as personality changes and hallucinations. For the diagnosis of dementia, there's actually no one test for it. Doctor diagnose dementia based on the medical history of the patient, physical examination, lab tests, and characteristic changes in thinking, everyday functioning, and behavior associated with each type. These may include measuring thinking skills such as memory, orientation, reasoning and judgment, and attention, evaluating motor functions such as movement and balances and reflexes. They can also include brain scans and psychiatric evaluation for other health conditions that might contribute to the symptoms. As for treatments, most types of dementia cannot be completely cured, but there are many ways to manage and improve symptoms through medications and therapy. Several dementia symptoms can be treated through therapy, however. For example, modifying the environment can help a person with dementia focus and function better. As scientists and doctors cannot cure dementia completely, many decide to tackle other diseases and conditions that might be a cause or consequence of dementia. A research study done by scientists in Australia and the US in 2018 concluded that inflammation is a major cause of dementia-related disease. Inflammation has been long known to increase as dementia-related diseases progress, and previously thought to act simply to clean up tissue damaged by the protein aggregates. But scientists found that many genes that are linked to dementia operate at the level of controlling cellular inflammation. Project leader Professor Robert Richards from the University of Adelaide's School of Biological Science linked brain inflammation to viral infection, saying that inflammation is a defense against foreign agents such as viruses, and as people age and accumulate more mutation, our cells can create proteins and DNA product that mimics viruses. But here's the good news. Since causes and treatment of inflammation are more well known than dementia, by reducing some elements of inflammation, it may be possible to reduce dementia symptoms. A different research done in the same year by Varam Harutunian, a professor of psychiatry and neuroscience at the Incon School of Medicine in New York City. He analyzed the brain tissues of people who have both Alzheimer and diabetes and found that anti-diabetic drugs may protect the brain against Alzheimer. The research found that people with Alzheimer and also take anti-diabetic medication exhibited fewer molecular markers of the neurological condition. There are still more researches that are done on dementia-related diseases. Just as there are many types and causes of dementia, there are just as many researches to improve the treatment. One research on each causes. On September 2018, the largest ever funding increase of $425 million for Alzheimer and dementia-related diseases research at the National Institute of Health was signed into law, increasing the current total annual funding at the National Institute of Health to go up to $2.3 billion. But even that amount is little compared to the cost of Alzheimer and dementia in the country, which is an estimated cost of $277 billion. Today, the number of Americans living with Alzheimer is more than 5 million, but the number is estimated to rise to nearly 14 million by 2050 at the current rate of research and treatment. But with the increase in funding, scientists are able to work at a more rapid pace to advance basic disease knowledge, explore more ways to reduce risk, uncover new biomarkers for early diagnosis and drug targeting, and develop potential new treatments for the disease. If some of you are still curious about the 85-year-old man at the beginning, the doctor took an X-ray of his abdomen and diagnosed the patient with volvulus sigmoid volvulus. His emergency was taken care of, but his difficulty to communicate with the care staff and doctors still remains. And that is my presentation. Thank you everybody for listening.